Out of the 21 patients of Omicron variant, 8 patients are from Maharashtra, and out of those, 7 are from Pimpri Chinchwad and Pune. To talk on this topic, with us we have Dr. Avinash Bhondwe, the former Indian Medical Association Maharashtra chapter's president. Yes, sir. What would you say? What kind of measures should one take so as we can keep ourselves away from this fifth variant of corona?
Yeah, this was a foregone conclusion that some new variant will come and patients will be rising and the third wave will begin. That was a foregone conclusion for quite some time. We were expecting that. Now, in last 2 days, all over India, we are getting around 21 patients, and it is definitely we have to take a lot of precautions because this Omicron is 5 times more contagious, transmissible than the previous Delta edition of the corona. So we have to take utmost precautions.
So, what kind of measures, like if the antibodies are not helping, if double vaccination is being done and still you are getting infected, then what should one do?
Uh, Omicron is rather showing escape phenomenon or resistance to all the known vaccine, as well as it is not working against, it is not giving any value to the antibodies which you have got after getting infected with the previous corona viruses. So it is really important that you have to take a serious, rather the definite a good precaution. And even if it is found that the vaccine will give only 40 to 50% protection right now, the new vaccine for the Omicron will be coming, but it will take some time, few months. So till now, you have to take vaccine. If you complete 2 doses, even if you get contracted with Omicron, you will get a milder variety, very small, the simple symptoms, and mostly you will not need to get admitted in a hospital, and of course the death will be prevented if you take vaccine.
Isn't it a good news? Because WHO also has confirmed that the symptoms are very mild. So people should not worry. They need not worry, but they should be following all of the social distancing norms.
Yeah, it is quite true that symptoms which are seen in this Omicron variety, they are very simple. Simple, the cold, cough, fever, but severe body ache and malaise feeling is observed. And of course, the two important symptoms, which are lack of smell and lack of taste, it is not observed in Omicron patient. But right now, since this is the beginning of the new wave or beginning of the this part of the pandemic, the in the symptoms will be very simple, but as the disease progresses, as the wave progresses, as the infection number progresses, uh, that they are definitely going to encroach all those above 60, and those are having comorbid conditions like diabetes, blood pressure, heart disease, kidney diseases, and so on. So once these people will get infected, then definitely the symptoms will change. We are expecting to get serious symptoms, severe symptoms, even the lack of oxygen, and of course few deaths. As per the reports from South Africa, still they are getting around 1500 15,000 patients per day, but they are getting all the milder symptoms. But in UK, they have found they have getting some patients who are little bit serious. The oxygen is going down, and these type of patients are seen in the age group above 60. So this is definitely going to happen in our country also. So though the symptoms are less, just don't ignore it. You have to take precautions because anytime the symptoms may change to the severe one.
Is genome sequence the only way to confirm that the patient or the person has been infected by Omicron?
To diagnose the Omicron virus, it is a simple RT-PCR test which we have been doing. We have to do that. In RT-PCR, you get S gene failure, and this Omicron diagnosis is made. And if this S gene failure is being observed, then the sample is sent for the genome sequencing. The genome sequencing is highly very costly test, and it is not available in ample amount in India. we have less funds. So right now, since the beginning of the Omicron patients, we are doing to confirm the diagnosis made by the RT-PCR. But as the disease will progress, if the number increases, of course, after some time, once the number of viruses, these Omicron viruses will be more than the other coronaviruses, definitely the only RT-PCR test will be the answer.
So you have heard Dr. Avinash Bhondwe confirming that the third wave has already begun in those countries where persons infected with Omicron have entered. At the same time, he has also said that there is no need for the public to panic, but alertness should be there. Social distancing, washing of hands, wearing of mask should be followed continuously. With Cameron Gopal Harnaj is Pankaj Khelkar in Pune for India Today.